10 strange signs your body needs more salt, hyponatremia. Did you know that a lack of salt may kill you? It sounds shocking, but it's true. Salt, or more specifically sodium, is vital for keeping your body's systems in balance. While we often hear about the dangers of consuming too much salt, the reality is that too little may be just as harmful. You might brush off a constant headache or nausea, but those could be your body's way of crying out for more sodium. If you've ever experienced unexplained fatigue, dizziness, or even mental fog, your salt levels might be to blame. In today's video, I'll walk you through 10 strange signs that could mean your body is desperately in need of more salt. Remember, if you suspect you're not getting enough salt or have any of these symptoms, it's important to consult with a healthcare professional to rule out any underlying issues. Let's start the video. 1. Persistent headaches. When your body lacks salt, it may lead to a persistent headache. Sodium plays a crucial role in maintaining the balance of fluids both inside and outside your cells. This balance is essential for regulating the amount of water in your body, especially in and around the brain. Without enough sodium, the fluid balance gets disrupted, causing an excess of water to accumulate inside your brain cells. This condition is known as cerebral edema or brain swelling, and it creates pressure inside your skull. Now, the brain is incredibly sensitive to changes in pressure, and when that pressure increases due to swelling, the result is often a painful, persistent headache. The type of headache caused by low sodium levels tends to be constant and may feel different from other types of headaches, like those from dehydration or stress. You might feel a heavy, throbbing sensation, and the pain may not go away even after resting or drinking water. The nerve cells in your brain also rely on sodium to function properly. Sodium helps transmit signals between nerve cells, and when there isn't enough sodium in your system, these signals may become disrupted. This malfunction in nerve signaling may contribute to the sensation of pain, making the headache feel more intense and harder to shake off. 2. Frequent nausea and vomiting. Nausea is one of the first symptoms to show up if your body needs more salt. This happens because your body struggles to manage its fluid balance without enough sodium. Sodium helps control the movement of fluids in and out of your cells, and when you don't have enough, water starts to build up inside the cells, causing them to swell. This excess fluid, especially in your digestive tract, may lead to discomfort and that queasy feeling we associate with nausea. The problem gets worse when the brain is affected by low sodium levels. Sodium plays a vital role in keeping your brain functioning properly, and when levels drop, the communication between nerve cells starts to malfunction. Your brain's vomiting center, located in the medulla, may become overstimulated as a result of these disruptions. When this part of your brain becomes too active, it triggers vomiting as a way to expel what your body thinks might be harmful substances, even though the issue is internal. This may leave you stuck in a cycle of nausea and vomiting that seems to have no clear cause. A case from the American Journal of Gastroenterology shows the complexity of diagnosing hyponatremia, nausea, and vomiting. A 62-year-old man with alcohol abuse and chronic conditions presented with severe nausea, vomiting, and altered mental status. His sodium level was critically low. 3. Unexplained fatigue. Unexplained fatigue is one of the most telling signs that your body might be running low on salt. Every time you move, your muscles rely on sodium to generate the electrical signals that cause them to contract and relax. Without enough sodium, your muscles can't perform these tasks as efficiently, leading to feelings of weakness and overall exhaustion. So even simple tasks like walking or lifting something may suddenly feel much more difficult when your body doesn't have enough salt. This lack of muscle function directly translates to fatigue because your body has to work harder just to perform basic movements. Sodium also helps your nerves communicate. Your nervous system uses electrical signals to transmit information between your brain and the rest of your body. These signals rely on a proper balance of sodium to work correctly. When sodium is low, the communication between your brain and muscles slows down, which may make you feel sluggish or mentally drained. You might find it harder to concentrate or stay alert, adding to that overwhelming sense of tiredness that doesn't seem to go away no matter how much you rest. 4. Frequent muscle cramps. Muscle cramps from salt deficiency may happen anywhere in your body, but they're most common in areas like your legs, arms, or even your hands. These cramps are often sharp, sudden, and difficult to relieve. You might try to stretch or massage the muscle, but the cramp persists because the underlying issue isn't just physical strain, it's a lack of the sodium needed to keep those muscles working correctly. Your muscles contract and relax through electrical impulses. These impulses are triggered by the movement of sodium and other electrolytes in and out of your muscle cells. Sodium, in particular, is responsible for starting this process. When there isn't enough sodium in your system, these signals may become weak or irregular, causing your muscles to contract uncontrollably or cramp up. You may notice this, especially during physical activity or even while you're just resting, as the imbalance makes it harder for your muscles to function properly. A review from PubMed highlights that electrolyte imbalances, particularly low sodium, are linked to muscle cramps and exercise-associated hyponatremia. 5. Confusion and cognitive impairment. The brain relies on electrical signals to communicate between neurons, which are the cells that carry information. These electrical impulses are made possible by sodium, which plays a key role in transmitting signals between neurons. When sodium levels drop, these signals slow down or become erratic, which makes it harder for your brain to process information quickly and accurately. This is why you might experience confusion or feel like your thoughts are slow or cloudy when you don't have enough salt in your system. Sodium also plays an important role in blood circulation, which affects how much oxygen and nutrients are delivered to your brain. Low sodium levels may cause your blood pressure to drop, which in turn reduces the amount of oxygen-rich blood reaching your brain. Without enough oxygen, your brain struggles to function properly, leading to cognitive impairment. You might feel easily distracted, forgetful, or unable to focus on tasks that would normally be simple. This cognitive fog may come on suddenly, and many people don't realize that something as basic as salt deficiency could be the cause. One study found that hyponatremia, or low sodium, increases the risk of dementia, including Alzheimer's, by about 2 times. Severe cases of hyponatremia posed an even 4 times higher risk. 6. Loss of appetite. Sodium is crucial for the production of stomach acid, which is necessary for breaking down the food you eat. Stomach acid, or gastric acid, helps digest proteins and absorb nutrients from food. When there isn't enough sodium in your system, your stomach may struggle to produce adequate levels of acid. This leads to slower digestion and may make you feel full or bloated, even if you haven't eaten much. As a result, your desire to eat decreases, and you may find yourself avoiding meals because food doesn't seem appealing. In addition to stomach acid production, sodium is essential for maintaining the proper movement of food through your digestive tract. Your digestive system relies on smooth muscle contractions, known as peristalsis, to move food along. Sodium helps trigger these muscle contractions, so when there isn't enough sodium, the movement of food slows down. This sluggish digestion may cause discomfort and a feeling of fullness, even when your body needs food. This, in turn, may cause a reduction in appetite because your brain is receiving mixed signals about whether or not you're truly hungry. 7. Frequent urination. Frequent urination is a surprising but significant sign of salt deficiency. Sodium helps control the movement of water between your cells and your bloodstream. When sodium levels drop, this balance is disrupted, and your body starts losing water more rapidly than it should. The kidneys, which are responsible for filtering and excreting waste, pick up on this imbalance and respond by increasing urine production in an attempt to get rid of the excess fluid. As you lose more water through frequent urination, your body's overall fluid balance becomes even more skewed. This may lead to dehydration, which, paradoxically, makes your body try to retain what little water is left. However, without enough sodium to manage this process, the kidneys continue to flush out water, thinking there's too much, even though you're losing essential fluids. This cycle of urination becomes a constant process, leaving you feeling dehydrated and depleted. A scientific report study found that reducing salt intake significantly improved overactive bladder symptoms. Of 98 patients, 71 reduced their salt intake, leading to better symptom control and increased bladder capacity. However, maintaining the general level of salt is essential. 8. Dizziness or lightheadedness. Sodium plays a key role in controlling the amount of water in your bloodstream. It helps your body retain water in the blood vessels, which maintains blood volume and pressure. When you don't have enough sodium, your blood pressure may drop significantly because there isn't enough fluid to keep it stable. This drop in blood pressure, particularly when moving from a sitting or lying position to standing, may cause dizziness or a feeling of lightheadedness. This is known as orthostatic hypotension, a condition where your blood pressure drops rapidly upon standing, making you feel like you're about to faint. Sodium also affects how your body circulates blood. When there's not enough sodium, your blood vessels can't constrict properly to maintain stable blood pressure. Blood vessels need to expand and contract efficiently to help regulate blood flow, especially when you're changing positions or engaging in physical activity. Without enough sodium, this regulation process gets disrupted, causing blood to pool in your legs and making it harder for your heart to pump enough blood to your brain. This may result in frequent bouts of dizziness or feeling lightheaded, especially during sudden movements. A Journal of Clinical Hypertension study found that higher sodium intake increased lightheadedness in people, especially in younger and obese adults. 9. Difficulty concentrating. Your brain relies on a network of neurons, or nerve cells, to communicate and send signals throughout the body. Sodium is a key electrolyte that helps generate the electrical impulses these neurons need to function properly. When sodium levels are too low, this electrical activity is disrupted, making it harder for your brain to process information quickly and efficiently. This may manifest as mental fog, difficulty focusing on tasks, or even feeling forgetful and scattered. Low sodium levels may also affect your brain's overall energy levels. The brain is one of the most energy-demanding organs in the body, using around 20% of the body's energy. Sodium plays a critical role in ensuring that brain cells have enough energy to perform their functions. When there's a deficiency, the brain doesn't get the energy it needs to stay alert and focused, leading to feelings of sluggishness and difficulty concentrating. You might find it hard to stay focused on even simple tasks or feel mentally drained even after minimal effort. According to PubMed, by 2060, 24% of the US population will be 65 or older, raising concerns about cognitive health. High sodium intake, linked to hypertension and heart disease, may also impair brain function. 10. Increased sensitivity to cold. Sodium plays a key role in maintaining fluid balance, which directly affects how your body generates and distributes heat. Your body's temperature regulation system, known as thermoregulation, relies on proper blood circulation to carry heat from your core to the rest of your body. Sodium is crucial for helping your blood vessels expand and contract efficiently. When sodium levels drop, your blood vessels don't function as well, making it harder for warm blood to circulate, especially to your extremities like your hands and feet. This may leave you feeling cold, particularly in those areas. Another reason why low sodium may make you more sensitive to cold is related to how sodium helps maintain your metabolic processes. Your metabolism generates heat, keeping your body at a stable temperature. Sodium helps ensure that your muscles, nerves, and other organs function properly, which requires energy. When you don't have enough sodium, your body's ability to produce energy drops, and this may lower your overall body temperature. As a result, you might feel colder more easily because your body isn't generating as much heat as it normally would. Now, let's discuss health conditions that cause salt levels to drop. I didn't realize how crucial the right balance of salt or sodium is for our body until I started learning about conditions that cause those levels to drop. Let's dive into the health conditions that may cause your sodium levels to dip too low and how they may affect you. 1. Hyponatremia. Hyponatremia occurs when your sodium levels fall too low, typically due to an imbalance between water and sodium in the body. This may happen when you drink excessive amounts of water without replacing electrolytes. The sodium gets diluted, leading to symptoms like headaches, confusion, fatigue, and in severe cases, seizures. Hyponatremia is common in endurance athletes and those with certain medical conditions that cause fluid retention. 2. Adrenal insufficiency, or Addison's disease. In Addison's disease, the adrenal glands don't produce enough hormones, particularly cortisol and aldosterone. Aldosterone helps regulate sodium, potassium, and water levels in the body. When it's deficient, sodium levels may drop significantly, leading to symptoms such as muscle weakness, fatigue, low blood pressure, and even fainting. 3. Chronic kidney disease. Your kidneys are responsible for balancing salt levels in your body, and if they aren't functioning properly due to chronic kidney disease, they may struggle to retain enough sodium. This may cause a drop in sodium levels, leading to symptoms like nausea, confusion, and muscle cramps. Managing sodium intake is often part of treatment for those with kidney disease to prevent further complications. 4. Heart failure. In heart failure, the heart is unable to pump blood effectively, leading to fluid buildup in the body. This may cause a dilution of sodium in the bloodstream, resulting in hyponatremia. People with heart failure may experience swelling, fatigue, and confusion when sodium levels drop too low. Treatment often involves managing fluid retention and adjusting sodium intake to maintain a proper balance. 5. Cirrhosis of the liver. Liver disease, particularly cirrhosis, may lead to low sodium levels. As cirrhosis progresses, fluid accumulates in the abdomen, a condition called ascites, which dilutes sodium in the bloodstream. This may lead to fatigue, confusion, and swelling. Maintaining the right balance of sodium is critical for managing cirrhosis and preventing further health issues. 6. Syndrome of inappropriate antidiuretic hormone, SIADH. SIADH is a condition where the body produces too much antidiuretic hormone, ADH, which causes the body to retain water. This excess water retention dilutes sodium levels in the blood, leading to hyponatremia. People with this condition may experience headaches, nausea, muscle cramps, and confusion due to the low sodium levels. This condition is often triggered by medications, lung diseases, or brain injuries. 7. Diarrhea and vomiting. Severe diarrhea or vomiting may cause a rapid loss of fluids and electrolytes, including sodium. If not replaced quickly, this may lead to dangerously low sodium levels. Symptoms like dizziness, weakness, and dehydration are common when sodium is lost through gastrointestinal issues. Rehydration with electrolyte-rich fluids is essential to restoring balance. 8. Excessive sweating. While sweating is a normal part of regulating body temperature, excessive sweating, whether from intense physical activity, hot weather, or medical conditions, can cause significant sodium loss. This is especially common in athletes or those working in high-heat environments. If the sodium lost through sweat isn't replaced, it may lead to hyponatremia, resulting in muscle cramps, weakness, and dizziness. 9. Diuretic medications. Diuretics, often prescribed for high blood pressure or heart failure, help the body get rid of excess fluid. However, they may also cause the kidneys to excrete too much sodium, leading to low sodium levels. If you're on diuretic medication, your doctor may monitor your sodium levels closely to prevent hyponatremia. 10. Hypothyroidism. An underactive thyroid may also lead to low sodium levels. Hypothyroidism slows down metabolism and may affect the balance of fluids and electrolytes in the body. People with hypothyroidism may experience fatigue, weakness, and confusion if their sodium levels drop too low. Now you know how important salt is for our body. While too much salt may cause problems, not getting enough may be just as dangerous for you and me. I hope this video helped shed some light on how crucial the right balance of salt is. And remember, If you're experiencing any of these symptoms or suspect you might have low sodium, it's always best to consult with a healthcare professional. Thanks for sticking around till the end. Now you're armed with the knowledge to keep an eye on your salt levels and stay ahead of potential health issues. Now that we have discussed the many signs of low salt, there are always other aspects of health we should look out for. Interested in learning more? Watch why you should avoid dairy if you have these 5 health problems, eye-opening. Or watch, the healthiest people in the world drink these 11 drinks every day. Watch one, or even better, watch both. Will you be taking in more salt deficiency seriously from now on? Let us know in the comments below.